The Limerick Writers Centre and Midwest Regional Drugs and Alcohol Forum has announced the launch of Frontline Voices, a powerful new collection that shines a light on the essential work being carried out with vulnerable populations across the Midwest region and beyond. To find out more about it, I'm joined now by Michael Lacey, who's living in Lisdoonvarna and is Chairperson of Midwestern Regional Drug and Alcohol Forum. Michael, thank you so much for being with us this morning.
You're welcome.
Frontline Voices being described as a powerful new collection. Can you explain what the project is and how it came about?
Okay, well, the Midwest Regional Drug and Alcohol Forum, we call it the Forum. In other parts of the country, they call it the task forces. The Forum is more community-based. And we comprise of voluntary, statutory and community individuals who come together to address the issues of drug, alcohol and mental health in the Western community. And our process is based on collaboration, emphatic solidarity, participative democracy, in that we don't invite people from the community in and state that this has been decided. We make decisions together. We are funded by the Department of Health. Now, I have to say we welcome the funding, but they're not necessarily based on participative democracy, more on central democracy, where they listen to the experts. They don't necessarily listen to the community. That's the Midwest Forum. Now, the Limerick Writers are a non-voluntary community group who encourage writing and literature developed in the Limerick region. So we had an awareness week some years ago, 10 years ago, and rather than have a day handing out leaflets and lectures on addiction, we decided to have a poetry competition where we got people impacted by addiction directly and indirectly, and we had a poetry competition. That worked out very well, and I think you interviewed us on that about 10 years ago, and we had voices from the cave. As a result of that was very successful. Our next publication was in partnership with the Writers Group, and we had free voices, and that was voices from people who are in prison. That was very successful. So our latest book, Frontline Voices, are an anthology and collection of poems and stories by people working in frontline, Garda, social workers, psychotherapists, and so on, and community, statutory and voluntary people.
Do you think, Michael, with some frontline workers often operate out of the spotlight, what do you think the wider public misunderstands perhaps about the work they do?
Well, often Garda are just seen as enforcing the law, but during COVID, I was on the National Oversight Committee with the for the reducing harm, sport and recovery, implementing the drug strategy. And Assistant Commissioner John O'Driscoll, a wonderful man, passed away in 2024, and he really experienced what was happening on the ground as a Garda, all the social issues. They were acting during COVID. They were the only people working on the ground as such, as well as some outreach workers experiencing suicide, domestic violence, drug addiction, mental health issues. And they sort of very much been conscientised by what was happening. And in the anthology, we have a wonderful piece by Dr. Andrew Lacey, who is no relation to me, who's a superintendent. And in his piece, he says, in the offices of the HSE Midwest and the corridors of the Garda station, something beautiful began to unfold. The artificial boundaries that once separated agency started to blur, replaced by bridges built from shared purposes. The vulnerable people of Limerick had always existed in the space between services, too complex for any single agency to address, too human to be reduced to bureaucratic categories. A person's mental health crisis doesn't check boxes marked police matters or health matters. They simply hurt, and they need to help that transcends organisational charts. And in the Midwest, there is a community access support team where, as the guard says, instead of coming with enforcers or handcuffs, they came with an understanding, empathetic hand to try to understand. And the guards working in partnership with mental health workers and social workers, etc. And that's the aim, to create that type of environment.
I just wonder, yes, Michael, whether you think hearing these stories can perhaps influence how community services or policymakers respond to issues such as addiction and vulnerability, that can have a positive influence in that regard. Absolutely.
That would be the aim. There is a tendency for the powers to be to listen to the experts. Now, the experts are not necessarily the academics. Like, reality determines consciousness, really. What happens on the ground? And it's the experience. If you the knowledge of, say, for example, nurses, public health nurses, who are working on the ground, listening to people, although the nature of their work is very task-oriented and hierarchical, matriarchal, and they're not necessarily encouraged to reflect, but they have wonderful experiences and tales to tell, as Garda do. Often there's a story by this guard. He goes to in the book. He goes on to address a burglary in Galway, and he goes and he meets this lady who's in terrible disarray as a result of addiction, and he drops his Garda shield as such and sits down and engages with her and starts telling her about himself. And he had an alcohol problem, and she was very bewildered, but it struck a chord with her and it led her on a path of recovery. It's a wonderful, moving story, you know. Yeah, and the stories are all about the human touch. Like, as people in authority, it can be difficult. It's often said the mortal human dressed in a slight attire of authority can do things that make angels cringe. But the person under the cloak of authority can do very positive things, can have a huge impact on individuals' life and steer them in directions.
Yeah,
and yes?
I would imagine, Michael, it means quite a bit for the frontline workers themselves to have their experiences acknowledged and documented in this way. You know, as I mentioned earlier, some of them are often operating out of the spotlight. Not that they're seeking the spotlight, but I'm sure they appreciate the acknowledgement of what the work that they do and how positive it is.
Well, can I tell you this? Trying to get this anthology together was like pulling teeth. The reluctance of individuals to come forward and speak about their experience. One, confidentiality. Secondly, they were not necessarily looking for acolytes. Thirdly, they didn't have the time. They were so busy all the time. Most people, the majority of people working on the front line are altruistic, are vocational, not necessarily religious or otherwise, but they're very caring people. And in a society today, which is quite worrying what's happening world-wise, it's wonderful that there are people, caring people working on the ground. Myself, I worked as a social worker for 40 years. I'm still working in the field. And it can be quite stressful and brutalising. But however, your colleagues, you meet some of the finest people you would ever meet. Social workers, Garda, nurses, doctors, who are not necessarily out to a big into competition. You don't see many rich on the ground outreach workers or social workers or counsellors or indeed Garda.
Yeah, but they want to make a positive difference to vulnerable people and make a positive difference in their community. And look, as you said, it was like pulling teeth getting the stories for this collection together, but they deserve the spotlight, even if they're reluctant to seek it. The collection is called Frontline Voices. It's been launched in Limerick City Hall on the 15th of January. Michael Lacey, Chairperson of Midwestern Regional Drug and Alcohol Forum, thank you for telling us more about that on this morning show.
And thank you for having me. Okay.
Take care. That's Michael Lacey with us on Morning Focus.